Hello, for those of you who don't know me, my name is Hunter Miller, and I will be presenting my critically appraised topic. My critically appraised topic is based off my PICO question of, is conservative treatment for ulnar collateral ligament more effective for patients in regards to return to activity than surgical treatments? I chose this topic because I'm very curious to know what kind of treatments exist for gamekeeper's thumb, which is more the layman's terms for ulnar collateral ligament injuries. I myself personally have gamekeepers, my injury occurred 5 years ago, and I was treated with conservative methods of a thumb spica immobilization, and I still have a lack of range of motion in my thumb, along with pain. Never truly became unsymptomatic. I have functional use of my hand, but sometimes it does give me pain, so I was really curious to dive into the literature and see what the experts had to say in regards to treatment and patient outcomes, so one day I may be able to better treat somebody with the same conditions, so years down the road they don't have continuous loss of function and pain in their thumb. So clinical scenario, I have some background information. For example, gamekeepers is a chronic injury to ulnar collateral ligament of the first metacarpal pharyngeal joint, whereas in the literature, an acute injury to the UCL is known as skier's thumb. Gamekeepers got its name from Scottish gamekeepers who used the thumb and forefinger to break the necks of the rabbits they had captured, placing a repeated valgus force on the MP joint. So that daily activity and that repeated valgus force over time just injured the UCL. UCL injuries of the thumb account for 86% of injuries in the hand, so it is a very common injury happening across all kinds of sports, such as skiing, football, lacrosse, any sort of sport where there's a lot of hand contact with either a ski pole, a lacrosse stick, or a football lineman going to block somebody and placing the thumb in a hyperextended position, because the mechanism of injury for UCL injuries is hyperabduction or hyperextension of the MP joint. The injury will present itself with hematoma, loss of motion, a loss of pinch strength, and tenderness upon palpation of the UCL ligament. If improperly treated, function and strength may never occur, as I previously stated in my own case. In my findings, I came across 5 articles, 2 are systematic reviews, 3 are literature reviews, and some of the key findings within this literature is there are numerous forms of surgical treatment of the ulnar collateral ligament, such as ligamentous reconstruction using allografts or autografts, joint fusion, and the use of sutures, K-wires, screws, and other methods. The main method of conservative treatment was the use of a thumb immobilization via a thumb spica cast or brace. With this method, there is also literature suggesting that the use of NSAIDs or corticosteroid injections may also be used to help reduce pain, but the thumb immobilization is the main form of treatment, and the patient remains in a thumb spica cast for 4 to 6 weeks with the goal of the scarring down of the UCL ligament to give rigidity and stabilization back to the joint. Other key points I've came across, there was one study that out of 64 patients who underwent surgical treatment, 51 had excellent outcomes, 11 good, and 2 fair. Surgical methods using a free tendon graft through 2 holes in the phalanx and one of the metacarpal bone was used in 26 patients, and 24 patients were getting stability and had no pain after treatment. In another study, bone anchors were used, and 14 out of 20 patients experienced no pain or gained stability after surgery. A different study showed 32 patients that were treated with a thumb immobilization spica, where all patients were satisfied with the outcome of their treatment after having follow-ups approximately 3 years after treatment. Clinical bottom line, there is strong evidence to support that surgical intervention has superior outcomes to conservative treatment of UCL injuries. While across the literature I found some positive outcomes for conservative treatments. In a lot of cases, the treatments were subpar compared to surgical interventions, which most of them have very good outcomes regardless of surgical intervention chosen. My search strategies for finding these articles, some keywords I used were ulnar collateral ligament reconstruction, conservative treatment for gamekeeper's thumb, rehabilitation for UCL of the thumb. Source of evidence search, I searched PubMed and Google Scholar to find my articles. Inclusion and exclusion criteria. Inclusion was patients with chronic ulnar collateral ligament injuries treated conservatively or surgically. The article was in English, published within 10 years. Exclusion was not available in English, published before 2006, or not available in free text. Results of search, 5 articles found, 2 were systematic reviews, 3 were literature reviews, as stated before. Implications for practice, conservative measures were found to be far less reliable than surgical interventions. One study I came across in the literature reviews was out of 32 patients treated with immobilization with thumb spica, 34% of patients remained symptomatic, having pain, loss of grip strength, loss of mobility in that joint. 5 patients remained unstable. 25% had a non-union rate. Giving this treatment only a 25% success rate, which is very poor. While another study with 93 patients who received surgical treatment after failed conservative treatments, these patients received surgery 1 month to 6 years after time of injury, and most patients made complete recoveries. Another study showed similar findings with 9 patients receiving treatment with a thumb spica for 6 weeks, who still had pain and loss of pinch strength after treatment. After receiving surgical treatment 6 months prior to the failed conservative treatment, these same patients had joint union 6 to 7 weeks post-op, as well as improved grip strength. So, in other words, they had increased stability and improved strength in the thumb. In a study which reviewed several methods of surgical interventions, which included bone suture, screws, the use of different tendon allografts, autografts, K-wires, etc. It found that 90% of patients had excellent to good outcomes regardless of surgical methods involved, showing that that most of these surgical interventions that are used are all highly effective in treating UCL injuries. One study used free tendon graft reconstruction on 51 patients with a 92% satisfaction rating, with only 1 patient remaining unstable and pinch strength being normal in all but 3 patients. More implications of practice. One study showed that with the use of pull-out sutures to reconstruct the ulnar collateral ligament, 23 out of 25 patients had good results and were able to return to full activity within 3 months of surgery. Another study suggested that the ideal surgical intervention for gamekeepers was the use of sutures to perform a static reconstruction with the use of a 12-week rehabilitation program was the preferred method of treatment, with 23 of 25 patients being able to return to full activity 3 months after surgery. I would like to suggest some studies. While throughout the literature I found several surgical techniques that had good patient outcomes, I would like to suggest the study that directly compares patient outcomes with different surgical methods. Throughout the literature I found a lot of singular reports on one type of surgical intervention. But there's a lack of literature comparing one or the other to determine which surgical intervention is more effective in treating UCL injuries. While there is multiple types of UCL injuries involved with gamekeepers and skier's thumb, it would be beneficial to compare different studies, such as with a tear of the UCL, comparing static versus dynamic reconstruction. So the use of sutures or bolts in a static reconstruction to reestablish the ligamentous structures to restore stability, versus using a dynamic, which normally uses extensor radialis brevis to attach to a point on the thumb to increase dynamic stability. I would like to see a study like that, for similar in nature. And these are my references. And